everyone, welcome back to our channel First View. Please hit like and subscribe and don't forget to push the notification bell for an upcoming video. In a significant shift that could reshape immigration policy and public health access, the Trump administration has introduced a proposal that would make it more challenging for legal Medicaid enrollees to obtain permanent residency. Unveiled on Monday, the rule would empower immigration officers to deny green cards to lawfully present immigrants who use Medicaid, food assistance, or housing support programs on the grounds that such benefits should not incentivize immigration and that immigrants ought to be self-reliant. This marks a revival and notable expansion of the controversial public charge doctrine that first emerged during Trump's initial term but was halted under President Biden. The Biden administration had rescinded the previous rule in 2022, aiming to remove barriers that prevented immigrants from accessing essential public services. However, the new proposal does not merely restore the old policy, it goes further by giving individual officers broader discretion to decide who may be considered a public charge even before new guidance is issued. The current motion, initiated by the Department of Homeland Security, Citizenship and Immigration Services, represent a clear regression from recent administrative effort to mitigate fear and confusion among immigrant communities. The agency's decision to repeal the Biden-era protection suggests a renewed determination to restrict access to social safety nets for immigrants, legal and otherwise. Public health and immigration experts warn that such a policy could produce dire consequences. The fear of jeopardizing future immigration status may push eligible immigrants and their families to forego essential medical care and benefits. Adriana Cajana, Executive Director of Protecting Immigrant Families, expressed deep concern over the chilling effect. Immigrants don't live in isolation. Many live in a mixed status families and out of fear. They are avoiding healthcare and other public benefits. We are already seeing declines in our patients' appointments. Indeed, research supports these concerns. A 2021 study highlighted that over a quarter of legal permanent residents avoided health services due to fears related to the public charge rule, even though they were not directly affected. Another study by George Washington University researchers found that the public charge provisions exacerbated racial disparities during the COVID-19 pandemic, as immigrants were discouraged from seeking testing and treatment. There is also an economic dimension to the proposed rule. The Trump administration estimates that nearly $9 billion annually could be saved from reduced participation in Medicaid and other programs. But this comes with a notable trade-off. Healthcare providers may face diminished revenues, and medical suppliers could experience financial strain due to reduced demand. Meanwhile, overburdened emergency rooms may see more patients who lack preventive care or costlier and less effective form of healthcare. The Department of Homeland Security will take public comment on the proposal for the next 30 days before issuing a final ruling. However, the implications are already generating widespread debate. If implemented, this policy would reinforce barriers to lawful immigration and create ripple effects that could impact public health, hospital system, and vulnerable communities nationwide, all under the banner of self-reliance, yet at severe social and economic cost. That's all for today. What your thoughts on this? Please let us know in the comment section below. See you later in the next video. Till then, take care.